Welcome to Healthy Living, brought to you by Novant Health. I'm Robyn Zimmerman. Comprised of Coastal Carolina Hospital, Hilton Head Medical Center, the Bluffton Medical Campus, the Bluffton Okatee Outpatient Center, and the Tidewatch Emergency Department, Novant Health is dedicated to providing our local community with compassionate, quality, extraordinary care close to home. Let's begin our program with a few health headlines. Lifestyle medicine focuses on 6 pillars of good health: nutrition, good sleep, physical activity, stress management, social connection, and avoiding risky substances. Here are some steps that we can all take to improve our health and feel better every single day. First of all, eat a rainbow every day. The number one thing people can do is eat more vegetables and fruit, more plants, less animals. Go for variety: leafy greens, corn, tomatoes, beans, berries, nuts, and seeds. Don't take life sitting down. Get moving. You've heard it before. Exercise does matter. At a minimum, shoot for 150 minutes a week of moderate exercise or 75 minutes of vigorous activity. Get your Z's. Even more important than exercise is restorative sleep. The magic number is 7 to 8 hours a night. Manage stress. From headaches and constipation to high blood pressure and increased risk for heart attack and stroke, stress strains the entire body and makes it hard to get the restorative sleep you need. To protect your mental and physical well-being, managing stress is a must. Don't go it alone. People need one another. And in fact, the number one key to a happy life is not to be isolated. It is called social fitness. And finally, avoid risky substances. If you smoke or chew tobacco, quit. Staying away from illegal drugs and limiting alcohol will also help lower your risk for heart and liver disease and even cancer. January is Cervical Cancer Awareness Month. Nearly 13,000 women in the United States are diagnosed with cervical cancer each year. It is one of the easiest gynecological cancers to prevent with regular screening tests. And there are 2 screenings proven effective to detect cervical cancer early. The first is a Pap test. With this test, cells are collected and sent to a laboratory to look for any abnormalities, and it is recommended young women begin screening with this test at the age of 21. The second test screens for human papillomavirus, or HPV. The human papillomavirus, HPV, is the leading cause of cervical cancer, and the HPV screening exam is recommended to start around the age of 30. For questions or to schedule an appointment with a gynecologist with Novant Healthcare, well, you can just contact Riverside Women's Care. Visit the website at novanthealth.org to find other physicians and more information on Novant's programs, services, and locations. And coming up after the break, we'll continue with this edition of Healthy Living with interviews from Novant's physicians and staff. Don't go away.